Similarly, indistinct endomyometrial junction is another finding which we find in adenomyosis. And if you see, compare between a fibroid and a focal adenomyosis, there is relative absence of mass effect, as I've shown you in fibroids. That mass effect is absent in adenomyosis. And the lesion is not so well defined as in a fibroid. Just show you some pictures. This is a patient with diffuse fibroadenosis. You have a bulky uterus, heterogeneous echogenicity. Think about adenomyosis. If you get an MRI done, you'll pick up adenomyosis very well in this. You have asymmetric thickening of the wall. The anterior wall is much thicker than the posterior wall. It's heterogeneous, patchy areas of hypointensity. And if you find these fine lines like this, coming like this, and with a poor penetration, think about adenomyosis. And this is the small ill-defined nodular lesions and the cysts which we see in the junctional zone here. This is characteristic of adenomyosis. This is also another adenomyotic patch which has gone into the subendometrial myometrium here. So ill-defined nodular lesion, not so well-defined like a fibroid. You have a doubt whether it's a fibroid or an adenomyoma. Most often it will turn out to be an focal adenomyosis. And if you do an MRI on these patients, you'll get features like this. You have a nodular mass, multiple bright T2 hyperintense foci, and this is indistinct planes between this and the junctional zone. And if you see here, such a big nodule, there's no compression of the endometrium. So there's no mass effect as compared to a fibroid. So this again a focal and asymmetric thickening of the anterior wall of the uterus, which is characteristic of adenomyosis. And this is a pseudo widening of the endometrium. The endomyometrial interface is very ill-defined, and you find these subendometrial small cystic areas and striated appearance. And if these small cystic areas are also bright on T1 weighted images, we know that they are containing blood, and this is a definite case of adenomyosis. And these are the striations sometimes which we see in the going into the junctional zone from the endometrial surface. These are characteristic of adenomyosis, and we can, on the MRI also you can see an indistinct outline as compared to the other side. This border is indistinct, and you can see these small striations going inside. So when we come to the sensitivity of sonography, sensitivity is more or less same as MRI, but when we come to the specificity, it is much more specific, and definitely I would like to use MRI when we suspect this condition. So there are a few mimics and variants which we have to know when we think about adenomyosis. One is the physiological, like in the first 2 or 3 days of menstrual cycle, the junctional zone can thicken and go up to 12 mm. So don't mistake it for abnormality at that stage. Similarly, there can be a transient contractions in the junctional zone which can look like focal adenomyosis, which may not be reproducible in the subsequent imaging. Then you think about focal thickening secondary to myometrial contractions. Sometimes you can have a cystic lesion like this. This is an adenomyotic cyst where you have a cystic complex lesion which contains blood products. As I've told you on T1, T2 weighted images, we have characteristics on that. And then we know that's an endometriotic cyst. And sometimes endometrial carcinoma can also coexist with adenomyosis, and sometimes it's difficult to distinguish between them. Thank you very much for your patience.
I am very thankful to Ram Raju for giving me this opportunity.